Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Using robotic devices to help stroke victims with physical rehabilitation is no more beneficial than therapy conducted without these complex and expensive devices, according to research published in the New England Journal of Medicine. Here is some information about post-stroke rehabilitation. It is designed to help stroke victims regain abilities they lost after their strokes, such as walking or dressing. It also helps stroke victims learn new ways to complete certain tasks to compensate for any remaining disabilities they may have. It is usually started as soon as one's health is stable following a stroke, often within a day or two of the event. Researchers from Brown University randomly assigned over 100 individuals whose movement in their upper limbs was moderately to severely limited by a previous stroke in one of three groups. The first group underwent intensive rehabilitation therapy with the aid of 4 robotic devices: a shoulder-elbow unit for horizontal movements, an anti-gravity unit for vertical movements, a wrist unit for flexion-extension, adduction-abduction, and pronationsupination movements, and a grass pan unit for closing and opening movements. The second group underwent an equally intensive rehabilitation program that did not involve use of these devices, and a third group received usual care. In all participants, the stroke had occurred 6 months or more in the past. After 12 weeks of therapy, those who follow the robotic-assisted rehabilitation program experienced greater improvements in functioning than those who received usual care, but were no better off than those who received intensive therapy without use of robotic devices. A second analysis looking at how the participants were doing after 36 weeks again showed some improvements in the robotic-assisted group over the usual care group, but not the intensive therapy group. Today's research suggests that intensive rehabilitation therapy can benefit stroke victims months and even years after their strokes, and that these benefits can be obtained without the use of complex or expensive robotic equipment. For Insider Medicine in Depth, I'm Dr. Susan Sharma.